Most commonly, we'll see pulled muscles in your legs, generally around your knee or your hip. And it comes from the fact that the muscles in your legs, your quadriceps, your hip flexors, your calf, your hamstrings, all of those muscles are very long muscles. Long muscles don't do a good job of stretching out and stopping. They'll most oftentimes stretch too far. And again, that's how you get that pulled muscle. So if you've ever had a pulled muscle, it'll present itself in a couple of different ways. Most typically, it's going to present itself as a stiffness or tightness or a soreness. And it might be right away, but typically it's sometime later on. Did a lot of work in the yard, a lot of squatting, a lot of bending, carrying some bags of mulch, whatever it might be, and you've pulled a muscle, let's say in your leg or in your back. Well, you'll start to feel that stiffness after you come into the house, after you take a shower, after you sit down, and then you go to get up out of the chair later on. Wow, there's all that stiffness, there's that soreness. Now, that's a warning sign, and I want you to be very clear of that. That's a warning sign that your body went under more activity than it was prepared for. And even though it might recover inside of 24 hours, which we would consider to be good, even though it recovers inside of 24 hours, that's a bit of a warning sign going off. That's kind of like the check engine light in your car. Hey, there's a problem here. And so I want that to be a warning sign and for you to really take note of that, and we'll talk about that a little bit more in a second. The second way that a pulled muscle can present itself is well beyond that stiffness and that soreness, and now it's actually a pain. It could be a sharp pain, it's a very deep, strong ache. Number one, it's there. Number two, it probably came on pretty quickly, and if it didn't come on pretty quickly, it's definitely lasting longer than 24 hours. Typically, along with that, you're going to have some problems actually straightening the joint out. So again, if we're talking about your knee, you'd have a hard time getting that leg out straight. You'd kind of be hobbling around for a day or two. That's a much greater sign of a stronger or harder muscle that's been pulled. And if it progresses far enough and you actually end up with a tear in the muscle, and remember, I said anytime you're pulling a muscle, you're getting these micro tears inside of the muscle. So the fibers themselves are kind of overstretching, swelling up a little bit, etc. But the third degree of a muscle pull, or a pulled muscle, a strained muscle, would be that you pull it so far that actually fibers of the muscle tear. You'll probably have a significant amount of pain. Inside of about 24 hours, you'll notice some bruising in that muscle or around that muscle. You'll definitely have some discomfort. You'll definitely have problems getting that joint out straight and moving it and using it. You'll probably also start to notice a little bit of weakness as well. What should you do if you're worried that you've got a pulled muscle? Well, the number one thing is stay moving. No matter where you are in the gamut of things, if you think you've got a muscle, a pulled muscle, you want to stay moving. Reason for that is you want to keep blood flow coming to that area. Now, if inside of that 24 hours your stiffness and soreness goes away, then the pulled muscle, quote unquote, has healed itself. But if you're having pulled muscles in the same area or in different areas more frequently than one every 6 months or more frequently than 3 times in a year, again, that's your check engine light going on. It might come on, stay on for a day or two, and then it goes away. But if it comes on and off, at some point you take your car in to get it checked, you need to bring your body in to get it checked. If you wake up the next day and you've got so much stiffness that you can't get the joint out straight, or you actually have some bruising or some swelling in that area, that's a sign. Or if it lasts for more than 24 hours, that's a sign that that pulled muscle is actually, now there's been some real tearing in that. We've got to get you doing some things to get that muscle to heal, because the concern is during the time that that muscle is not doing its job, it's allowing things in the joint to not work mechanically correctly. So again, if we're using your leg as an example and you've pulled your hamstring muscle, and it lasts for, again, more than 24 hours, or it's happening repeatedly, that muscle isn't doing its job to protect the knee joint, which sets you up for the increased possibility of arthritis developing and things along that lines. But more importantly, it sets you up for the potential that you're going to damage or tear the meniscus in the knee, that you're going to set yourself up for some ligament problems. And more importantly, if a muscle isn't healing itself inside of 24 hours, it's going to have a hard time healing itself, and you're setting itself up for actually tearing. So it goes from those micro traumas to an actual tear. No bruising or anything, and then bam, you're walking down the stairs 3 days later, pop, all of a sudden now you've torn that muscle. If you're using physical therapy like the expert therapists that we have here at Loudon Sports Therapy Center, we can help you to recover from any pulled muscle, even if it's that short-term stiffness, or it's something that's been happening repeatedly, or it's some big thing that just happened and you've got a big old bruise somewhere, etc. The number one thing the physical therapists are going to do is they're going to get their hands on you. They're going to work that tissue to help to increase blood flow to that tissue, to help that muscle to lengthen back out the way that it should, to get it all unknotted from itself, to get rid of the stiffness. then to work on getting mobility back, getting strength back, and ultimately getting you back to the activity you want to get back to without having to worry about future injury, arthritis setting in, ligament problems, etc. So again, if you've had a muscle pull, or you've got any stiffness or soreness that's lasting for more than 24 hours afterwards, happens more than one time in 6 months, or happens more than 3 times in a year anywhere in your body, that's a sign that you've got some potential problems developing, and PT, the expert therapist here at Loudon Sports Therapy Center, can really help you. So give us a call, click on the link, let's get that taken care of, let's get you out in the yard, doing the things you want to do outside, being active, and not having to worry about, number one, pulling muscles, and not having to worry about pulled muscles coming back to haunt you in the future.